session today, having Dr. Richman with us. It's a real pleasure. We're wondering how long has he been here to teach our residents, but it's more than 5 years for sure. And the important thing is I was asking Meg, with whom we have a wonderful friendship for many years now, that if at UCSD, in the Department of Radiology, they have the same situation. Hey Jay, how you doing? And the truth is, very little faculty go to the conferences because they have a lot of work to do. So it's happening the same that is happening to us. You know, the residents go because they need to learn, which is a good thing. And I see very pleased that we have with us our administrators that want to know, and friends, and also Dr. Jane Marion, the former chair of internal medicine. You know, Dr. Meg Richman is a professor of radiology and is interested in those things that will keep us healthy and happy. I don't know wealthy, but and what I can tell you though, that she has a very active lifestyle. She's a tremendous, great teacher, and also is a runner of half marathon, because that's her dose of exertion that she uses. So today she will talk about gut instincts.
Right.
It's a very provocative name.
Right?
Go ahead, Meg.
Thank you. Thank you, Dr. Diaz, for inviting me. It's always a highlight of the year to get to come and spend time with you all. So it's not necessarily radiology, but it is about keeping us healthy and our patients healthy and our families healthy. So I like to start with a quiz to make sure you all are excited about the information. Don't shout out the answer, but in this article it was red meat plus wrong bacteria equals bad news for hearts. What happens if you give the microbiome of a third trimester woman to a sterile mouse? Who's healthier, a baby born by C-section or by vaginal delivery? What happens when you give an autistic mouse one form of bacteria? And then what is this cartoon illustrating? Lots of poop in the hospital, little poop, bigger hospital. And microbiome and osteoporosis. What happens after ovarian ablation to the bones in these mice? Okay, let's hit it. So what's the overview? What is the microbiome? So if you look, you see the lining of the gut cells here, and all the bacteria you see in here is the microbiome. It's the gut bacteria that we have all along our GI tract. And we used to think, oh, that's just disgusting. That's why we always wash our hands after we go to the bathroom. But actually, the microbiome is incredibly important for our health. So what is the role of the microbiome? It's protective. It makes nutrients, and it fights for nutrients and receptor competition against pathogens. It is important in immune system development, and it leads to the development of mucus, which is a protective layer along the intestinal tract. In terms of metabolism, it metabolizes carcinogens, and it makes metabolites and vitamins that are critical. And then it ferments non-soluble carbohydrates. That's what the microbiome eats. So who has more genes? We think we're all evolved, so we must be the most genetic around, but actually we have 21,000 genes. The water flea beats us at 31,000 genes, and the microbiome 4.4 million. So what does that mean? How have we evolved? We've evolved to use our microbiome to get greater genetic variability. So we rely on our genes within our microbiome to make up for deficiencies we have in our own genome, because they can alter much more quickly than human genome can. So some words we're going to be doing with today. Probiotic are the bacteria we ingest for health. Prebiotic is the food the bacteria eat. Dysbiosis is when you have disruption of the microbiota. FMT, I'm sorry you're eating lunch, but anyway, FMT is fecal material transplant, so just bear with me. SCFA is short-chain fatty acids. A pathobiont is a bacteria that is normally benign but can act in a malevolent fashion. So when we eat food like this with lots of fiber, then our bacteria are super happy. And when the bacteria in our gut are super happy, they make short-chain fatty acids, which then benefit us in terms of it's the energy for the lining of the gut, and it correlates with health, and it gives us 10% of our calories. So the most common short-chain fatty acids, acetate, propionate, and butyrate, they again provide energy to the gut cells, add 10% of our calories, and they promote health. So when you have low levels of short-chain fatty acids, that correlates with an inflammatory state. So what about diversity? When they're now studying the microbiome all across the world, in the globe, and you see the USA here in blue, and we're not very diverse. When you look at Venezuela and Malawi, much more diverse. And is that a problem that we're not as diverse? Yes, because the Western microbiome is much less diverse, and when you see that lack of diversity, that correlates with the incidence of what we call the Western diseases. What about heart disease? So I showed you this as part of the quiz. Red meat plus wrong bacteria is bad news for hearts. And so the microbes turn nutrient in beef into an artery clogging menace. That's the wording from the article. And so what are they showing here? They're showing the blood vessel, and you're seeing that the lumen is narrowed by this gray material. And what is that? That's the cholesterol. And what happens is the bacteria are making this stuff that prevent us from removing that cholesterol. So what is going on here? TMAO. What is TMAO? TMAO slows the reversal of arterial wall's cholesterol. And actually, the level that we have of TMAO is predictive of heart attack risk, stroke, and death, independent of other risk factors. If you divide people up into the top 25% highest versus the lowest 25%, the people in the top 25% have 2.5 times the risk of all of these things compared to people in the lowest level. And it seems to be a better risk factor than cholesterol, triglycerides, and other risk factors that we typically think of as cardiovascular health. So what is TMAO? Well, when you eat meat and dairy, they have carnitine and lecithin that the gut bacteria convert to TMA, which then is converted to TMAO in the liver. So it's a byproduct made by the bacteria. What's interesting is the bacteria don't benefit from this. So I don't know why they're making it, but the problem is it's dangerous for us. It comes from the lecithin and carnitine in the meat and dairy that you don't find in plant-based foods. And again, the levels that you have of TMAO correlate with the risk of heart disease. Vegans and vegetarians have much lower levels. In this study, one vegan, they convinced this guy to eat a meal of meat. And so he had steak, and after eating it, despite having steak, he had very low TMAO. Then, for whatever reason, he was convinced to keep eating meat for a week. After a week, the level increased. So what that means is, as you'll see, is your microbiome changes rapidly. And so after he started eating meat for a week, the microbiome changed and started making TMAO. Avoiding meat reduces the gut bacteria that turn carnitine into TMAO, while regular helpings of meat encourages their growth and thus the production of TMAO. What about obesity? So you take the microbiome of a fat mouse and give it to a sterile mouse, and what happens? That mouse then gets fat. Is it because he ate more? No. The skinny mouse gets fat on the same caloric intake and the same amount of exercise. What about bears? What's interesting in this article is, or this study, they took the microbiome of bears at different times of the year. When they took the microbiome from bears in winter with low firmicutes, it's a kind of a family of bacteria, that mouse stayed thin. When they took it from the bear in the summer, when the bear is trying to get very fat very rapidly, high in firmicutes, that mouse became fat on the same exercise and caloric intake. Same thing happened when you took the third trimester microbiome and gave it to a sterile mouse, that mouse got fat. So the microbiome of a third trimester pregnant woman makes the mouse fat on the same caloric intake and exercise. So my daughter, I blame this on my daughter. I tell her this is all her fault. What happens with sterile mice given normal microbiome? They have a 60% weight gain in 14 days while eating less. And obese mice compared to normal mice, 2 times less Bacteroidetes, so a family of bacteria, than firmicutes. And this same ratio is found in humans. Some scientists say that they can predict whether a person is obese or not just from the microbiome within about 90% success. Let's say you have a woman, 5'4", eating 2,000 calories a day. If that woman has an obese microbiome, she starts absorbing an extra 2% of calories. And you think, oh, well, that's not much. 40 extra calories a day is 1.9 extra kilograms per year. And in 10 years, that's 19 kilogram weight gain, which takes her from a great BMI to a horrible BMI with the same kind of caloric intake. So we used to say calories in is calories in, right? You take 100 calories, I take 100 calories, we both get 100 calories, and that's not necessarily true. Calories in is not necessarily calories in. It can be different depending on the microbiome we have. When they looked at twins, discordant twins, one fat, one thin, the mice given the fat twin microbiome became fat. The mice given the thin twin microbiome stayed thin. For obese mice to become thin, they had to have a diet high in fruits and veggies and be low fat. How might the microbiome make us fat? We have more efficient energy harvest. They change the fecal stream transit time, how quickly the poop goes through. They change our taste buds. They change how we distribute fat. Can they change our behavior? That's very interesting. We'll talk about that in a little bit. And like I said, some scientists can predict obesity 90% of the time by the microbiome. Here they're looking at basically 300 people, Danish people. When they found those that had a rich microbiota, they found that they expressed many genes. And the people that had great microbiomes had anti-inflammatory bacteria and were thin. The Danish people that had poor microbiota, few genes expressed, they had lots of inflammatory bacteria, and that correlated with insulin resistance, obesity, and increased procarcinogenic compounds. They did something similar in France, looking at French people. When they asked the people with a poor microbiome about their diet, they found that they ate many fewer fruits and veggies. When they then placed these people on low fat and calorie, but higher protein and fiber diet for 6 weeks, they lost weight and increased their gene richness of their microbiome. This corresponded to less inflammation, lower cholesterol, and other health markers. Studies in mice convincingly show that reinforcement of a lean microbiota with a diet high in fruits and veggies is essential to overrun an obesity-promoting microbiota. A diet that helps nourish these lean microbes allows them to effectively invade the obese microbiota and protect the mice from weight gain, changing the host's destiny. What about babies and kids? So who's going to be healthier, a baby born by C-section or a baby born vaginally? Vaginal delivery. Who's going to be healthier, those with lots of siblings or an only child? Siblings. And who's in general going to be healthier, coming from a lower socioeconomic background or higher? Interestingly, those tend to come from a lower socioeconomic background. So this is a little graphic, but still, when a baby's born, typically head first and head down, pointing to the nether regions. And what does that allow the baby to do? It gets exposed to mom's microbiome. And that allows that baby to get a microbiome. And so we know that vaginal delivery is incredibly important, as well as breastfeeding. So what happens with C-section babies? They are not exposed to mom's bacteria that come from vaginal delivery. And it turns out C-section babies have higher risk of obesity, asthma, allergy, celiac disease, autoimmune diseases, and cavities. They have a higher risk of colic. And so some are recommending that if a woman has to have a C-section, that they take swabs bathed in the mom's vaginal canal and around the perineal area and bathe the baby with it, swab the baby down to allow the baby to get exposed to the microbiome and then populate their own microbiome to prevent the higher risk of this. When they look at colic in babies, so the 24 babies, half had colic, half had not. When they looked at the colicky babies, they found they had a much less diverse microbiome, more proteobacteria, less bifidobacteria, and lactobacillus. And the microbiome was similar to C-section babies that were formula fed. What about breast milk? Turns out that the third most common ingredient in breast milk is HMO, which is human milk oligosaccharides. What's interestingly is that the baby cannot digest it. So that HMO is not there for the baby. It's there for the baby's microbiome. That's how important this microbiome is. We've actually made this stuff in breast milk to feed the baby's microbiome. Breastfeeding also provides special microbes. Some studies suggest that at least 9 months of breastfeeding is ideal. What about probiotics? As adults, our response to a stress, our ability to learn and remember, and even the finer points of our personality could be a result of the state of our microbiota early in life. So it's important that we get kids a microbiome and that we promote it by trying to lessen antibiotics and make sure that they're eating good food. So, what about autism? I thought autism was just something either a kid got or didn't get. Now it turns out the microbiome is incredibly important in autism. When they looked at 13 autistic versus 8 normal children, the autistic kids had 10 times the amount of Clostridia, type of family of bacteria. And the theory is that the neurotoxin released by the Clostridia led to the brain damage. So in this study, they were looking at autistic mice. And these autistic mice, not only did they have abnormal behaviors, but interestingly, they had gut problems. They had leaky gut. They had reduced intestinal integrity, dysbiosis, and chemical imbalance. They gave this mice just one type of bacteria, Bacteria fragilis. And just from that one, they restored normal intestinal integrity, restored flora, fixed the chemical imbalance, and reduced the abnormal behaviors. So they were more solitary, more repetitive behaviors, and they became more communal and had more normal behaviors just after the introduction of this one bacteria. So again, what are the recommendations for newborns and kids? Avoid C-section if possible. If C-section is necessary, use a vaginal swab. Breast milk is definitely best. Try to avoid antibiotics. If antibiotics are necessary, give probiotics. Make sure they're on a nutritious diet filled with pre- and probiotic foods. And consider yogurt, and I would argue for vegan yogurt every day to improve their immune system.
Question. How do you have vegan yogurt?
Oh, there's soy, coconut, and almond milk-based yogurts. Mm-hmm. And some people use chia seeds. There's a variety of different vegan yogurts. In terms of antibiotics, so let's say this is just kind of a snapshot of the microbiome before antibiotics. What happens after just one series of antibiotics? We lose a third of our microbiome. Do they bounce right back? No, they don't. So this is one of the recent grads from UCSD. She made this beautiful drawing for me. This is kind of what the gut looks like after antibiotics. It's a ghost town, right? And then Clostridia can take over, right? So antibiotics in the first 6 months of life, especially associated with weight gain. Antibiotics especially affects bifidobacteria, and bifidobacterium is very important in a child's immune system. When they looked at acne patients, 85,000 acne patients, long-term antibiotics, they had twice the number of colds and upper respiratory infections. And looking at college students being on antibiotics, they had 4 times the risk of colds. This study in 14,000 women in the United Kingdom, kids given antibiotics before the age of 2, 74%, meaning 3/4 of the kids in the UK in this study had antibiotics before the age of 2. They had 2 times the risk of asthma, and the more antibiotics they were exposed to, the more asthma, eczema, and hay fever. In this Swedish study, what was the impact on Bacteroidetes and clindamycin? 7 days of antibiotics, the Bacteroidetes decreased immediately, and 2 years later had still not normalized. That can be the impact on the microbiome. What about weight gain? So when you look at antibiotic-treated mice versus non-treated mice and you give them the same calories, the antibiotic-treated gained more weight. Side note, this is why farmers give antibiotics to the animals to cause rapid weight gain. 80% of the antibiotic use in the United States is for livestock, not for humans, right? Because they want to get the animals as fat as possible, as quickly as possible. Going back to autism. When they look at kids with autism, 93% had an ear infection before 2 years of age. Compared to normal kids, 57% had an ear infection before 2 years of age. In a different study, kids with autism, 3 times more exposure to antibiotics than other kids, and kids given antibiotics before 18 months of age were at the greatest risk. What about the impact of antibiotics on autoimmune disorders? Increased risk of Crohn's if they had antibiotics as a kid. The odds ratio is 1.57. Celiac patients, 40% more likely to have had antibiotics shortly before diagnosis. Lupus. Teenagers treated with minocycline, an antibiotic for acne, had 2.5 times the risk of lupus. But this is when you combine both males and females. If you separate out the females, 5 times the risk of lupus after the minocycline, the treatment for the acne. What about the gut? It's interesting, as they study the microbiome, they find that we have bacteria all over our bodies, inside and out. And the bacteria are very different when you're looking between the mouth, the skin, the vaginal area, and the fecal area. What we're seeing is that patients, especially inpatients, when they're given antibiotics, their whole microbiome changes. And so this is another drawing that she did for me, and I just love this, that after antibiotics, the bad bacteria, kind of like gang members, take over the microbiome, right? And the happy bacteria are shoved over to the side, okay? And so what can happen is, I'm kind of showing Clostridium here, after antibiotics, the folks can have a much higher rate of Clostridium, and their microbiome changes dramatically compared to what it should be for the fecal area. If you give a fecal transplant, within days, their microbiome becomes normal, and this turns out to be life-saving. So actually, it was apparently back in China in the 4th century, they actually called it yellow tea. So they were actually talking about fecal transplants even back then. The first reported medical one that we know of was in 1958. In 2013, a Dutch study, they looked at patients that had failed antibiotics for Clostridium difficile. After 1 fecal transplant, 81% were cured versus 31% who got a second round of antibiotics. Of the ones that weren't cured, that 19%, they were given another fecal transplant, an overall cure rate of 94%. The study was stopped and the fecal transplant was offered to the controls. I thought it was great. This one company is trying to make crapsules, so you don't actually need the fecal transplant, you just take the crapsules. What about Crohn's? Again, like we talked about, increased risk of Crohn's if had antibiotics as a kid. Antibiotics associated with increased risk of new onset Crohn's disease. They looked at 7,000 patients, odds ratio 1.57. So dysbiosis, meaning they had a disrupted microbiome in Crohn's. Decrease in diversity, more E. coli, decreased production of butyrate, that's one of the short-chain fatty acids, and decreased firmicutes. Mucus, we always think of mucus as disgusting, but actually mucus is really protective along the gut. And so what do we find? What is that mucus? The mucus layer kind of keeps the bacteria in the fecal stream away from the lining of our gut. And it turns out that the bacteria promote this production of mucus. So if you give someone an antibiotic, the bacteria that make the mucus disappear, and now we have these bacteria way closer to our gut lining. We also know that in between the gut cells, we have these tight junctions. And what can happen is that the tight junctions can fail. So here's your bloodstream, here are the tight junctions, and here's the fecal stream of the bacteria. So you can have breakdown of these tight junctions. And we might think, well, why might that happen? So you may have heard the term leaky gut. Why might we have a leaky gut? Turns out we humans make a protein to do that. And the protein is called zonulin, and it can break down so much that it's basically an open thoroughfare. Why do we think that we evolved to do that? Originally, the thought was that by flushing out water through these tight junctions, get rid of the tight junctions, flush out water, we can get rid of the pathogens. But what can happen is reverse, is the stuff can get in the opposite direction. So if you give antibiotics and remove the ability to make zonulin, this doesn't happen anymore. So, but instead, if you break down those tight junctions, what can happen is that bacteria and large proteins get exposed, get into our bodies and into our bloodstream. So you get bacteria, toxins, and undigested proteins, like milk protein. So you've heard a lot of people are sensitive to gluten. They think that's one of the problems that's happening is the leaky gut, gluten. We're getting exposed to gluten where we never were before. And that's for celiac disease. LPS is these little scaly-like things along bacteria. They can also get in. Is that important for our health? Yes. Being exposed to LPS, cytokine release, that means inflammatory cascade. It triggers the inflammatory cascade, perpetuates inflammation, makes fat cells larger, causes weight gain, and it interferes with insulin, making people basically pre-diabetic. So just this one bacteria, what they found was that it repairs intestinal leakiness. It helps get rid of that leaky gut. It promotes colonic epithelial cells to secrete molecules to patch up that leaky grout, to make those tight junctions better. So every day it seems that they're finding another disease that's associated with the microbiome. So it's amazing, from A to Z. So inflammatory bowel disease, of course, but acne, eczema, psoriasis, urticaria, HIV infection, not getting it, but the severity of it, hepatic insufficiency, irritable bowel syndrome, arthritis, celiac disease, autism, food allergies, pancreatic insufficiency, and even osteoporosis associated with leaky gut. Autoimmune disorders, when did we really start seeing them take off? After World War II. And after World War II is when antibiotics became more available for the human population, right? So first it was for the soldiers in World War II, and then it became released to everybody. And as soon as World War II and that era was over and the antibiotics started getting released, now we see this marked uptick in all of the autoimmune disorders, type 1 diabetes, asthma, Crohn's disease, multiple sclerosis, rheumatoid arthritis, you name it. So autoimmune disorders affect 10% of the population. 1 in 5 kids now has asthma, 1 in 15 kids is allergic to some kind of food. I hadn't realized that diabetes type 1, it was incredibly rare before World War II. For 75 years, they had reported 21 cases in 500,000 patients. Before World War II, 1 to 2 in 5,000 kids had diabetes type 1. Now it's 1 in 250 kids. Multiple sclerosis has increased twofold, celiac disease 30 to 40 times compared to the 1950s. So we kind of know that the immune system is kind of a Goldilocks phenomenon, right? You don't want it to be too active, okay? And that leads to autoimmune disorders. And you don't want it to be too inactive, because then we are at risk of infections. Treg cells, what are they? They're there to kind of help modulate the immune system so it's not too reactive. They help to kind of quiet it down. Turns out autoimmune patients have a paucity of Treg cells, so therefore they have an overzealous immune system. This is associated with inflammatory bowel disease, autoimmune disorders, and cancer. So the hallmark of Western diseases is having low Tregs. So some think, what about repopulating Tregs? Might that offer treatment? In mice, firmicutes, this one family of bacteria, help recruit Treg cells to the gut, and therefore less likely to develop colitis, allergies, and autoimmune disorders. What about aging? This study, I thought it was interesting. They were looking at 3 clusters of older folks. They were looking at people aging at home, people in day hospitals, sort of like adult daycare, and people in long-term care. So we're mainly going to look at these 2 disparate populations. The people that were aging at home, they had a young person's microbiome, higher fiber, more short-chain fatty acids, lower inflammation, and better health. Then let's move to the long-term care. These folks were eating low-fiber food because it was easy to chew. They had much less diversity in their microbiome, and that correlated with the frailty. So then they said, well, which came first? Did the diet change come first or the microbiome change? So in the study, the diet changed in 1 month after going into the assisted living. So the diet changed within 1 month. The microbiome change took a year, and the frailty correlated with the microbiome change, not with the diet change. The other thing we know is that with aging, the immune system declines. So we get this pro-inflammatory state. And that's also associated with dementia and arthritis, as well as other things. So what about pathobionts? Pathobionts are bacteria that are normally benign, but they can be a bit malevolent. As we age, the number of pathobionts increases with aging. And in gut inflammation, increasing in number is associated with perpetuating inflammation. Mice fed saturated fats, they saw an uptick in their number of pathobionts, but not seen in animals fed plant-based polyunsaturated fats. Osteoporosis. In this study, so here's a sterile mouse. So the sterile mouse has no microbiome. Here's the normal mice that have a microbiome, and all of them, their bone health is great. These are all female mice. In the study, they then did ovarian ablation, basically made all these mice menopausal. And then they studied, so what happened? Well, you notice that they have a decrease in their microbiome. This one stayed the same because it didn't have a microbiome. What happened to their bone health? All of these mice developed leaky gut, and all of these mice, except the sterile mouse, lost half of their bone mass. What does that tell us? It tells us that the loss of bone mass is associated with the microbiome, that the microbiome led to the loss of bone mass. By losing half their microbiome, they lost half their bone mass. So ovarian ablation led to loss of half the bone mass, but only in the non-sterile mice, showing the role of the microbiome in this. So then they said, well, is there a way that we can hold off the bone loss? So then they repeated the study. In this group, they gave them one type of probiotic. Here they gave a different type of probiotic. This one they gave E. coli, and this one they did nothing. They just were going to do the ovarian ablation again and repeated the study. So you see in this one, even after ovarian ablation, this one, because they gave them this form of probiotic, they kept their microbiome. So in this one, the E. coli in this one didn't work so well. This one wasn't given anything, so lost half their microbiome. And so what did they find? These mice got to keep their bone mass. This one still lost half. This one, of course, still lost half. And this one, the sterile mouse, got to keep their bone mass. So the probiotic prevented bone loss, but they needed to have the correct probiotic. So from this, they said, probiotics reversed hypogonadal-osteopenia in sex steroid deficient mice by preventing the disruption of gut bacteria, or excuse me, by gut barrier function and dampening cytokine-induced inflammation. The results of this study highlight the potential for repurposing probiotics for the therapy of osteoporosis. Future placebo-controlled clinical trials will be required to establish safety and efficacy of probiotics in reducing fracture risk in people. Well, I mean, you can eat yogurt. You can eat vegan yogurt and not have any risk and try to prevent osteoporosis. So to me, there seems to be no downside. Why not do probiotics? What about mind and mood? So they call these mice the Woody Allen mice, and I'm calling these one the Ninja Warrior mice, okay? And so what's the difference between these two mice? You stick these mice up on a pedestal and you watch to see how quickly they jump off. The Ninja Warrior mice, they jump right off, right? You stick them on a pedestal, they are down within seconds. The Woody Allen mice, they are very, very, very scared. And so they're up for maybe 4 minutes on this pedestal before they start to jump down. So folks have said, well, what if we give them a fecal transplant? So let's give the Woody Allen microbiome to the Ninja Warrior mice and see what happens. Well, now these mice are much more scared, and it takes them much longer to jump off. What if you do the reverse? You give the Ninja Warrior fecal transplant to the Woody Allen mice, now they jump off much more quickly. So isn't it amazing that the microbiome can affect our behavior? According to the WHO, depression is now the leading cause of disability in the United States. Can the microbiome affect our mood? Yes. Here's one study looking at probiotics and functional MRI. Women fed probiotic yogurt 2 times daily. Controls ate sterile yogurt or nothing. When they looked at rest and they were looking at negative face photos, they saw a noticeable difference in those on probiotics. Brain regions involved in sensory input and emotion, frontal, prefrontal, and temporal cortices, and periaqueductal gray matter. Important areas for anxiety, pain, and irritable bowel syndrome. So lactobacillus, these probiotics can help. More than 500 studies linking probiotics to behavior, especially anxiety and depression. In this study, 55 humans given a fruit bar with or without live bacteria. They ate 1 bar a day for 30 days. The study group getting the living bacteria, they reported more happiness, less anxiety, and anger. They had increased tryptophan levels, so higher serotonin. Now you're saying, well, how did they get the increased tryptophan? The bacteria don't make it, they just prevented the body from breaking it down. And so we see that just like with everything else, depression is associated with dysbiosis. Prebiotics. What are prebiotics? Prebiotics are fertilizer for your microbiome. So where do you go to get prebiotics? You go to your produce section of your grocery store. Basically everything here, fruits and veggies, all have native fiber, and that's what our bacteria want to eat. So these types of fiber are best for making short-chain fatty acids in the colon. Inulin, so artichokes, garlic, leeks, onions, wheat, rye, and asparagus. Fructooligosaccharides in fruits and veggies, including bananas, onions, garlic, and asparagus. Resistant starch you find in grains, barley, rice, beans, green bananas, legumes, and potatoes. Interestingly, for the beans and the potatoes and legumes, if you cook them, then cool them, they have even higher rates. I'm not quite sure why, but isn't that interesting? Pectin, apples, apricots, carrots, oranges, and others. And I can't say this one, arabinoxylan, in cereal grains such as wheat bran. What about our diet? Does diet affect the microbiome? Yes, in two ways. It affects the kind of bacteria we have in our microbiome, and it affects the chemicals the bacteria produce. So, increasing dietary fiber is essential for microbiota diversity and function. So we want a Big Mac diet, but this kind of Big Mac diet, which means we want a microbiota accessible carbohydrate diet. The Macs are what the gut bacteria are feeding on. So we want fruits, veggies, legumes, unrefined whole grains to create and maintain a diverse microbiome. And the microbiota is directly responsive to our diet. We benefit again from the short-chain fatty acids that they make. So here's another diagram. So when we're eating foods like this, all these great veggies and fruits, look how happy those bacteria are. They are just singing in there. They are just delighted, right? So instead of this kind of Big Mac, we want this kind of Big Mac with a lot of the great carbohydrates that the bacteria want to eat, the microbiota accessible carbohydrates. If you say, nope, I want to stick with my Mickey D's, I want to have my traditional Big Mac, the problem is, and there's nothing for the bacteria to eat, so what are they going to eat? They're going to eat you, or at least your mucus layer, right? So that's really what we want to avoid. So no fiber in your diet, then the bacteria eating your mucus layer, and it compromises your immune barrier, increasing inflammation. It can lead to colitis. If you start eating fiber, they'll switch to eating it. So eat the MACs, the microbiota accessible carbohydrates. Burkitt, this is the doctor that discovered Burkitt lymphoma, right? He spent a lot of time in Africa, and he found that Africans ate 3 to 7 times more fiber intake, so 60 to 140 grams of fiber versus 20, and most Americans are lucky to get 20 grams. They had 3 to 5 times more massive stool, and they had 2 times faster gut transit, and he found that this correlated with health. So, what kind of poop do you want? In this book, they say, easy to pass and comes out in one long snake-like piece without any cracking, which is an indication of constipation. The lack of a splash means you're on the right track. So this is the cartoon made from Dr. Burkitt's observations, right? He found, as in Africa, when there's huge amounts of poop, there's a small hospital because people aren't sick. If, on the other hand, like the Western areas, you have a small amount of poop because everyone's constipated, then you have a really big hospital because everyone's sick. So this is his quotation. Societies that eat unrefined foods produce large stools and build small hospitals. Societies that eat fiber-depleted foods produce small stools and build large hospitals. What about saturated fat? Why is saturated fat bad? For many reasons, but also because it encourages pathobionts, which then triggers inflammation. So go for the plant-based stuff, like avocados. What about artificial sweeteners? Is that also associated with the microbiome? Yes. So these consumption of artificial sweeteners is associated with increased risk to develop obesity, metabolic syndrome, and diabetes type 2. And you may be saying, well, wait a second. It's the diabetics that are really drinking this stuff, right? But it causes all kinds of havoc. Why? The artificial sweeteners induce glucose intolerance by altering the gut microbiome. The other thing that they found is that each molecule of this stuff releases a molecule of methanol, which metabolizes into a molecule of formaldehyde. Formaldehyde, which is a known highly reactive substance, is classified as a known human carcinogen with no safe level of consumption. So unless you want to preserve yourself from the inside out, probably best to also avoid the artificial sweeteners. Is there any benefit to trying a more vegan way of eating? Vegan microbiome is distinct from omnivores, fewer pathogens, more protective species, lower inflammation. Reduced levels of inflammation may be the key feature linking the vegan gut microbiome with protective health benefits. So we've seen that vegans have a lot less risk of cancer, heart disease, dementia, osteoporosis, on and on. And what she's saying here is maybe it's by reducing the level of inflammation through the gut that is allowing these health benefits. So if you're eating a lot of meat, Bacteroidetes, versus eating more veggies tend to have more Prevotella. So is meat bad? Several studies show that a meat-centered diet impacts the microbiota in a way that is detrimental to health. We talked about TMAO already, right? Remember that meat has L-carnitine, especially red meat, and that microbes turn that into TMAO, which increases the risk of stroke and heart attack. In this study, they did 4 weeks of a high-protein, low-carbohydrate diet, and what happened? So this is more of the Atkins diet. They saw a dramatic decrease in the short-chain fatty acids. Did that matter? Yes, a dramatic buildup in hazardous metabolites. Does your diet affect your microbiome? Yes. It affects it rapidly and reproducibly. So they had 10 people. They ate different ways for 5 days. So for 5 days, they ate plant-based, grains, legumes, fruits, and veggies. And then for 5 days, they did animal-based, meats, eggs, and cheeses. What they found is that within 30 hours, the microbiome changed. They changed the gene expression noted with the animal-based, right? So when the animal-based 5 days, they had this nasty bioacid that is associated with increasing liver cancer and inflammatory bowel disease. In this study, only 6 subjects, they made them vegan for 1 month, saw a reduction in firmicutes, rise in Bacteroidetes, and lowered all of the following. So they lowered their weight, the triglycerides, LDL, cholesterol, and their hemoglobin A1C just by being vegan for 1 month. What about rheumatoid arthritis patients? Over 1 year, they shifted from a conventional to a vegan diet. The study group ate living food with bacteria. The fecal profile significantly changed for the study group even at 1 month. And the degree of the difference correlated with clinical improvement. We conclude that a vegan diet changes the fecal flora in rheumatoid arthritis patients, and changes in fecal flora are associated with improvement in rheumatoid arthritis activity. And this is true for all the autoimmune disorders.
Question?
Yeah.
The previous slide, what do you mean by living?
By living food, stuff that had bacteria in it.
Oh.
So any fermented food, yogurts, sauerkraut, kimchi, anything like that is living food.
Not something that's still alive.
No. Good point. No. There's actually the American Gut Project. You can actually get your gut fecal flora sequenced, so you can tell what you have in it. Find out what's in your microbiome. For $99, you can find out just 1 time. For $180, you can get 2 times, so you can do yourself in 2 different time periods. You can do you and your partner. You can do you and your dog, whatever you like. You can get it for $3. You can do you and your cat, whatever you like. Probiotics, right? So what are probiotics? These are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. That's the official definition. So most probiotics don't stay in the gut. So you're saying, well, why take them? They reinforce the intestinal wall. They prime the immune system defenses against invading pathogens. It kind of wakes up the gut, if you will, to be aware of pathogens. It strengthens that grout, those tight junctions between GI cells. It promotes the secretion of mucus, and it increases the release of defenses, chemicals against invading bacteria, viruses, and fungi. So this is a study they did on kids, ages 3 to 6, about 640 of them. Fermented dairy drink versus placebo, 25% less likely to have a GI infection if they took the drink, less likely to have needed antibiotics, and fewer upper respiratory infection. And this has been found for all age groups. So what are the official clinical recommendations for probiotics? There's a whole host of entities for which probiotics are recommended. There's no way you can read this. But here's just some of the support for probiotics. Necrotizing enterocolitis in preemies, Clostridium difficile, acute diarrheal illness, inflammatory bowel disease, also for irritable bowel syndrome, allergies, eczema, radiation enteritis, liver disease, and even for the common cold. So this guy, he wrote this great book, if you're interested in more, called The Good Gut. Whenever anyone in his family feels like a cold is coming on, or they feel like they're getting sick, they up their probiotic intake. These are 2 of the most commonly medically prescribed probiotics, VSL and this LCR35 strain. If you're looking for a good probiotic, probably best that it's refrigerated. So if you're getting it from Amazon and that kind of thing, make sure that it's coming refrigerated. Or go to places like you guys have a Whole Foods, right? Whole Foods and that kind of store will have probiotics. So are these FDA approved? No, right? Why? Because the companies don't want to go through the rigor of having to get them FDA approved. So most are not considered drugs. So therefore, these companies are not required to undergo testing. Most strains have not been tested. Most strains that you see in probiotics have just been chosen arbitrarily. Most are GRAS, meaning generally regarded as safe, but this is a voluntary program. And there's no guarantee that the product has the bacteria listed or how much of the probiotic is in there. And there's no, well, they say no direct documentation of health benefits from any one particular bacteria, but they're hoping to change that. One recommendation is if you want to see if your probiotic is active, is you take a cup of milk, you put the probiotic, you break the capsule into it, and see if the milk curdles. So how to start? Hippocrates, right? We took the Hippocratic Oath. He believed that all disease started in the gut, and he believed food should be thy medicine. And boy, was he right? Because of all the importance of this microbiota in the gut. So before I used to think of these guys as microbial monsters. I hope you now are with me in thinking that they are our bacterial buddies. So what Dr. Sonnenberg recommends is get in the habit of starting each meal by assessing the dietary fiber content of the food on your plate. If you don't see anything that will provide food for your microbiota, think about key substitutions and how you prepared or ordered your food that could have improved the MAC content. So is it good enough to just have one meal a day that has fiber in it? No. So if you're eating eggs and bacon for breakfast and then a turkey sandwich for lunch, there's nothing there for the microbiome. So we need, at the very least, to every meal have something that the microbiome can eat. So here I am. This is, I don't know if you've heard of the I Heart Guts company. They make stuffed animals of various organs. So here's the colon. And there's my little bacteria. And so I'm trying to make sure that every meal I eat has something for the microbiome. So again, not a Big Mac diet, but this kind of a Big Mac diet with lots of veggies in there, lots of fiber. So what are the 4 tenets for a good diet? You want a Big Mac diet, so eat your carbs, not the processed carbs, but the carbs basically out of the garden. Limit meat consumption, limit saturated fat intake, and consume microbes and probiotics. And you say, well, what about the gas, right? Especially as you transition to this way of eating, you're going to have some gas, but that will get better as your microbiome changes. Or you can do what we do in our family is you get a dog and then you blame it on the dog. We have 3 dogs. And so, if there's gas, you just blame it on the dog. So how do you pump up the microbiome? Eat fiber, eat beans, fruits, veggies, grains. Expose yourself to more bacteria. So they recommend have a garden with organic soil, go to a farm, have pets, interact with lots of people. And some say that these harsh cleaners we're using in our house are actually not that helpful. Consider less harsh house cleaners like vinegar and lemon juice. So again, if you don't eat for the bacteria, they're going to start eating you, so be careful of that. Diet is a powerful and accessible tool that enables everyone to take some control in programming or reprogramming the microbes that govern so much of our biology. So again, for kids, right, newborns, babies, and kids, try to avoid C-section. If a C-section is necessary, consider using a vaginal swab. Breastfeeding is absolutely best. Try to avoid antibiotics. So we're seeing more and more antibiotic use, so try to be careful of that. If the antibiotics are definitely necessary, give probiotics. Make sure they're on a nutritious diet with lots of fruits and veggies. That's pre- and probiotic foods. And consider yogurt, and again, I would recommend vegan yogurt every day. Inflammaging, that's what they call it as we get older and we start having inflammation. How to prevent it? Again, we want a diet rich in these MACs, low in saturated fats from animal products, increased fiber and lower fat consumption correlates with greater short-chain fatty acid and less inflammation. And of course, exercise helps, but we don't have time to talk about that as much. So getting back to the quiz, okay, red meat plus wrong bacteria is bad news for hearts. What are we talking about here? We're talking about TMA and TMAO. Do you get that from all foods? No. It's from the meat and the dairy, have L-carnitine and lecithin, and certain bacteria will convert that to TMA that's then converted to TMAO. And remember that the TMAO levels are correlating with heart attack and stroke and death. Okay? So you avoid the meat and the dairy, you will basically tamp down the bacteria that do this. What happens if you take the 3rd trimester microbiome and give it to a sterile mouse? You make that mouse fat. So what does this mean for us? We want to encourage a 1st trimester microbiome, right? So it's not just calories in, it's calories in. It's important to have the right microbiome so we don't gain too many calories. In autism, just by giving this one bacteria, they were able to get rid of the intestinal dysbiosis. So they had normal integrity, normal flora, and then back to more normal behaviors. So there is some research going on for kids with autism. Giving them probiotics, and one study was looking at a fecal transplant, and the fecal transplant for the autistic kids definitely improved behavior. Dr. Burkett, big poops, small hospital, little poops, big hospital. So we want to have really healthy fecal transit. So eat lots of fiber. So good fiber, big poops, no disease. Yay. For osteoporosis, again, what helps stop the loss of bone mass? Again, it was after they gave this probiotic. So certain probiotics definitely helped keep those mice from losing bone. Is there any danger? In my mind, there's no danger to doing the probiotics, so why not to help try and prevent osteoporosis?
Is it like different probiotic for each person? Or?
That's what they're going to be looking at. So Dr. Knight, who runs the American Gut Project at UCSD, he thinks that within 5 years, you'll basically do a breathalyzer kind of thing. You just breathe into something, it can tell what microbiome you have, and then they're hoping that soon we will have specific recommendations for people based on what their microbiome is, what diseases they have, what kind of probiotic they should have. But right now, it's just they don't have enough data to know. But it just seems like just exposing yourself to more confers health benefits. A great question. Yep. And that's it. Any other questions? We're right on time. Yeah?
Wonderful. Any questions?
So the two you put up on the screen, are those are by prescription?
Those, actually VSL I think you can get from Amazon. There's a whole variety of probiotics. What I like to do is go to Whole Foods. I like to get a vegan probiotic. There's the one that I like is Dr. Probiotics. It's actually a company. They make a bunch of different varieties. They have one that's there for mood. I mean, who doesn't want a little bump in mood? So it's got an herb in there that helps with mood, and it's a vegan base for the probiotics. So I take that as a supplement every day when I'm not traveling. So I find that it helps. But the ones that are often prescribed by doctors are the VSL and the LSR ones.
Has it been shown if multivitamin intake affects the microbial flora?
That I haven't looked at. He asked about the multivitamins. I haven't looked at multivitamin use and the microbiome. We know that multivitamins in general can be harmful depending on what's in there. Vitamin A, beta-carotene, selenium, taken as a supplement actually increase your risk of death and ill health. So be careful about a multivitamin. Best to have targeted things like vitamin D, depending on what your vitamin D level is. If you're going to be plant-based, then you need B12. So just a whole, just a random, a multivitamin supplement, in general, those are not a good idea. But I haven't seen that specifically related to the microbiome.
Is there like data to say like cooked veggies or cooked greens are not as good as fresh? You know what I mean?
So, that's, I haven't looked into the science behind that argument. There's a bunch of people that swear by the raw diet, right? There's definitely some foods like tomatoes, the lycopene from tomatoes is better after being cooked. So most people recommend a mix of both, that you have both cooked food and raw food so that you get the benefits of both. I would think that all is going to have fiber, so that's what the gut bacteria are going to eat. But if you can avoid eating everything cooked, I think that's better. So at least probably one person says a quarter, another person says a half of what you're eating should be raw veggies versus cooked veggies. Did I see another hand go up? Yeah.
What is your opinion on fish, eating fish?
Yeah.
I've heard that people who eat fish along with otherwise vegetarian diets tend to live longer than vegans.
The only study that I've seen that specifically looked at that was the Adventist study. It was a 12-year study looking at Adventists. Adventists, one of their prophetesses said not to eat meat and dairy. So you have a whole range of eating behaviors within the Adventists. Some people full-on omnivore. Next is the pescatarians, the ovo-vegetarians, and the vegans. And when they compared all of those, the longest life people were the vegans. The next was the lacto-vegetarians, and after that was the pesca-vegetarians. And what they did was they compared hypertension, diabetes, BMI, and they found that the only people with the normal BMI were the vegans, and the vegans were also the lowest risk for hypertension, diabetes, and other health risks. Why might fish be a problem? We've heard of omega-3s, so you're thinking, okay, I've got to have my omega-3s. You can get that from algae-based foods. The problems, what I've seen with fish, any animal product has IGF-1, which acts as a growth factor for things you don't want to grow, like cancer. And there was one video I saw from Dr. Greger, who scours the literature, and they have seen an uptick in ALS in people eating seafood. And they think it's because of blue algae that has been increasing because of agricultural runoff. And so it used to be when I would cheat, I might do a little salmon here and there, and after seeing that video, I'm like, no. So any animal food tends to make your body acidic. It has the IGF-1 growth factors, and we know that fish tends to be high in pollutants depending on what kind of fish you're getting. So that's why if you can't get rid of fish, well, at least get rid of everything else, but try to be sparing in the amount of fish that you're eating, is what I would recommend. Other questions? These are all great questions.
Any comments? Okay, great. Thank you.
Great, thank you very much.